we'll start with that and what we've been doing at administration. We've been engaged with the governor and senior staff throughout the process of moving Grand Forks to yellow and moderate risk level last week. I've engaged with bar and restaurants owners on moving to yellow and the reduced guideline of 50% capacity. Sent a letter out including the North Dakota Smart Restart guidelines in an email, and I want to thank Councilmember Dockler for your engagement and on the importance of communicating with community members on these guidelines and them being enforced. I'm even having a meeting with them tomorrow at 3 o'clock to talk about their concerns and looking at that 11 p.m. shutdown along with the 50% capacity and figuring out a way forward. And I think it's important that they get to talk directly to me and I can hear things firsthand and they can hear my thoughts firsthand. On top of that, I went on a police ride-along on Friday night to check on enforcement of that 11 p.m. Closure time, and I think it worked pretty well. I saw everything clear out. We got to go around. I think it is working. It's not the perfect thing, but it was targeted at where the problems were happening, where we think we're seeing the problems happening. So that was great to see. I went and monitored testing events both at the Laris Center and at the High Performance Center. On Friday, I even got tested, and I wanted to check the turnaround time, and I got my results back within about 30 hours. In that Friday event, it was great to see Public Health Department working hard, and also I got to see 4 of our firefighters, and actually got tested by one of our firefighters. Chief Lorenz and President Armacost also joined me at the event. And another thing, bringing up the fire department, there was a fire there at 310 Cherry just yesterday, and that was tough to see that families that got displaced by that. But one thing that I was pretty excited amidst all this and COVID. Within hours on Facebook, I saw fundraising efforts to try to help that family. So that was really pretty great. We put pen to paper on our city-owned building safety plan and policies. I also want to thank Councilmember Dockler for helping out with that. This week as well, I followed up and got status updates from a lot of the senior living facilities, including Valley Senior Living, Memory Care, and Edgewood. I've been engaging with subject matter experts at UND, state and federal experts, including the White House Coronavirus Task Force. Myself and Todd also toured Ultra this week, including the COVID wing, and we're in constant communications with Ultra's upper management. And I want to thank Dr. Weiser and Mr. Molman for the tour and bringing us in there. We've also been on tours with manufacturing companies, including LM Wind Power, Philadelphia Macaroni, and PS Industries, as well as other manufacturers to see how they're managing COVID in their workplace. I've also met with numerous church leaders and seeing how they're handling their COVID response. We're meeting weekly with institutional partners, including Ultra, UND, Grand Forks Public School, the Air Force Base, and the county. As well, this one I can benefit to my kids, but going to soccer practices and hockey tournaments and sporting events and gauging the benefits, as far as weighing having sports in the community. I think that's a really important thing to continue, and I think it's great to see the children to be able to go out and still experience that despite all this. I want to thank Mr. Weber for certainly all of his work that he's done, both in assembling the expert panel, as well as the work that his interns have done on the mass study and helping to move forward with the health officer's dashboard. Looking at the past and where we're headed, I think so far through it all, we've done a pretty good job. We had a spike when students came back. That's troubling. We've responded with targeted and reasonable actions to create sustainable balance, to not just include physical, but mental, emotional, and economic health, and a lot of those can be equally as important. This is a pandemic, and no plan is going to be perfect. We're doing the best we can. We need to stay positive on our future and on the future of this community, but at the same time, we need to buckle down as we're getting past this expected spike in college students, and we're starting to see numbers come back down, so we're hoping that trend continues.